Hi, what's up, guys? Welcome back to another interesting episode on the show Behind the Scenes in Health with Dr. Ron. My name is Ronald and I discuss everything healthcare, health tech, alternative careers. Sometimes I do live interviews on this channel. So if you're looking for interesting stuff about healthcare, you're in the right place. So just hit the subscribe button, take a pause, share this channel with others, and then come back to this video. On today's episode on the show, in my last video, I talked about one of the exciting healthcare careers, which is medical photography. And I got the question, what's the difference between medical photography and clinical photography? I'm going to do a different video about clinical photography entirely, what it requires and all of that. But in today's video, I'm just going to be talking about differences between medical photography and clinical photography. Now, both of them, they're interrelated. They sometimes mean the same thing, but there are subtle differences between medical photography and clinical photography. And I'm going to looking at them from the broad perspective, the purpose, the subjects, and the settings, so that's going to give you an idea of what both of them look like. So let's look at medical photography. What's the scope? Now, looking at the broad perspective of medical photography, you're looking at a wide range of subjects beyond clinical settings. So now you're looking at capturing images for medical education, for research, for presentations, for publications. And you're also documenting, surgical procedures, you're documenting anatomical structures, you're documenting skin conditions, surgical procedures, medical equipment, and a whole lot of things. So it's very broad-based and wide. And now, where's the purpose for medical photography? The primary purpose is usually for education and research, So most of the images captured are useful for knowledge transfer, training, and dissemination of knowledge within the healthcare and medical community, right? And for medical photography, they work in diverse settings. So talk about hospitals, talk about research institutions, talk about educational facilities, and sometimes some of them even accompany you to medical outreaches, medical missions, research expeditions in different parts of the globe. So that's how broad and diverse medical photography is. And in terms of the things they capture or images and picture, again, it's very broad-based. You're looking at medical specimen, you're looking at laboratory procedures, you're looking at medical technology, you're looking at things beyond core patient related issues, really. Now let's look at what happens in clinical photography. Now, clinical photography is more specifically focused on documenting patients and their clinical conditions. So you are really focused on what happens to the patient. Somebody comes in the clinic with a skin condition. That is what you want to capture. He's coming to follow up. The wound is healing. That is what you want to capture. So basically involves the capturing of injuries, diseases, skin conditions, and surgical outcomes, right? Now, the main purpose of clinical photography is for patient monitoring and treatment outcomes. So a patient comes to the clinic the first time, probably with a skin condition, maybe eczema, a unique type of eczema or something. You take a picture of that, you document it. He started his treatment and he's coming back for follow-up, and you keep taking pictures until probably the eczema goes or the person is healed completely. So these images are typically used for diagnosis, treatment planning, monitoring progress, and maintaining a very comprehensive patient record. So for example, one of the key use cases of some of those images, like we'll talk about diagnosis, for example, in dermatology. So I could take a picture, or you have a picture, you send it to a colleague, teledermatology, they make a diagnosis. And so I'm just trying to give you a use case scenario for clinical photography. Now, in terms of settings, clinical photography happens wholly or solely in the clinical settings. So we're talking about hospitals, clinics, and private practices. So basically anywhere patient care is delivered, that is where clinical photography happens. And in the subjects, like we said, we are focused on medical outcomes, interventions that surround patients, right? So that's the major differences between medical photography and clinical photography. So in summary, medical photography is much broad-based and clinical photography is more narrow-based. You are focused on just the patient itself. So I mean, the choice of which one you get into depends on you, and that's solely up to you. Mine is just to highlight these differences and allow you to make your pick. If you've enjoyed this video, please give us a like, subscribe to the channel, and share this video with other persons who you think might benefit from this video. And until I see you in the next episode, I still remain your host, Dr. Ron, and I'd like to say bye for now.